Neighbours for active living, better health, better care, together with the community. And they'll be joined today on stage with Miss Bessie Yap as well as Miss Nikma binti Mahadi, both of whom are volunteers, is that right? For our Neighbours for Active Living program. Please take a seat. The Neighbours for Active Living program is spearheaded by the Southeast Community Development Council and supported by the Eastern Health Alliance. Now, it provides holistic support for clients with high healthcare and social care needs after they have been discharged from the hospital. So let's find out about how the program has benefited the clients as well as improved care.
A very good afternoon, everyone. And first, I must commend all of you for your energy and your enthusiasm. This is the last session of the day. You know, it's been a busy program and, so much information. And I see everyone so attentive and so interested. So thank you, everyone. Right. Okay, there's going to be two parts to this presentation. I will first start by explaining about this program, Neighbours for Active Living. And after that, you get to hear from Bessie and Nekma from the volunteers' perspective. Okay, now this is something that you see in the newspaper all the time. Singapore rapidly aging, right? And by 2030, three times increase from 300,000 to 900,000 people who are aged 60 and above, rapidly aging population in Singapore, right? And we know the challenges that come with aging, right? People living alone, more diseases, falling sick, more frail, and so on. So what has the government done to address this? Now, when you think of healthcare, right, what do you think of? You think of the hospital, Tan Tock Seng Hospital, Khoo Teck Puat Hospital, Changi General Hospital, and so on. These are hospitals, people fall sick, they come to hospital, get treated. But our government says we must do more, right? We must look after the people, right? Whether young or old, while they're still well. So government set up regional health system, right? Look after the population, whether young or ill, well or ill, right? Young, right? So there are 6 regional health systems in the north, Alexandra Health. Just now you heard Dr. Wong Swee Fan shared about it. The anchor hospital is Khoo Teck Puat Hospital. For me, I'm from the East, Eastern Health Alliance. Eastern Health Alliance is the regional health system for the East. The main hospital is Changi General Hospital, right? And we have a couple of partner institutions with us. St. Andrew's Community Hospital, we have Sing Health Polyclinics, Health Promotion Board, and we have a nursing home, Salvation Army P7 Nursing Home, right? Where we are now, Tan Tock Seng Hospital, right? The regional health system is National Healthcare Group. Now, earlier, Dr. Wong shared about the Aging in Place program. There are equivalent programs, and the equivalent program in the East is the Neighbours for Active Living program, and that's the program that I'm going to share with you this afternoon. Now, the NSG, right, Tan Tock Seng Hospital also has a program, also called Neighbours program, right? We shared the program with them, and they've started it. Sing Health, SGH, their program is called Patient Navigators. Now, there's a different flavor. You go to different parts of Singapore, some part better Peranakan food, some better chicken rice, and so on. Alexandra Health and Sing Health, they have used a nurse-led program. So earlier, you heard from the nurse perspective. For us, Eastern Health, NHG, we have taken a social work perspective, right? So Zahara, who leads the program, is a social worker. Then you'll ask, why the difference, right? So one big difference is, what are the resources in the community? You see, once you look at the whole population, there's so much to cover. Can't do it alone. Who else is there in the community that you can work with, you can partner with? So in the East, we have a very strong partner, St. Andrew's Community Hospital. They provide home medical, home nursing service. They have the doctors and nurses. So that component is there, right? So what we are focused on is the social care component, work together, solve the problems together, right? So Neighbours for Active Living is a partnership, right, between the CDC. So in the East, we have 2 CDCs, right? Earlier, you heard from Swee Fan, Northwest. So in the East, we have Northeast, Southeast CDC, and there's so 2 components, a professional team and a volunteer arm, right? And we are embedded in the community. So Zahara and her team, 80% of the time in the community, 4 out of 5 days out there in the community. Why? Because that's how you know the people, right? You know the partners, you know the residents, work together closely, understand what are the real issues, right? And we look after the whole continuum from social to medical. Earlier question, how long do we look after the clients? For as long as they need it. What does that mean? Usually until they pass on or when they get admitted into a nursing home. Then you say, wow, so many patients, how you look after? Well, how we do it is together with community partner, with the volunteers, right? Because we know for elderly people, when they get sick, right, what happens? Okay, they recover, but the moment that you take your eye off them, they're going to deteriorate quickly, right? So we are there all the time, right, with partners, watching them, helping them all along for as long as they require it. So this is the team. We have about 40 staff, right? So the professional team in our blue uniform, like what Zahara is wearing, right? And we cover the entire eastern region. Okay. So we started a bit later than KTPH, so we had a chance to learn from them. We started in 2013, quite modestly, and we have grown, and today we cover more than 3,000 residents in the east. Okay. So what do we do? Financial assistance, social support, medication, and so on. Now, medication adherence, big problem, right? In hospital, everything taken care well. Go home, everything falls apart. They don't take medication. Why? It could be because, they are not eating. When you don't eat, you're not going to take your medication. Why are they not eating? Because they are alone, social isolation. A lot of times when we are alone, we don't eat. So the main problem about medication adherence, you trace back, sometimes social isolation. Bring them out, meet someone, right? They have the friend, they eat, and then they take the medication. So that's how sometimes we approach the problems. We have reduced the admission rates, and of those who are admission get admitted, they get admitted less. So a very key component of this program is the volunteers, the Neighbours volunteers. Now, our mayor, Dr. Maliki, has a saying, 远近不如近邻. Why not a near neighbor rather than distant relative? Someone to stay next door, right? Every day, pop by, how are you? Are things okay? So what we do, Neighbours team, go in, assess, stabilize the person, right? After that, Neighbours pop by every time. If previously the person walking every day, now suddenly cannot walk. You know something is wrong. What do? Call the Neighbours team. Zahara and her team comes in, assess. So Neighbours never alone, the volunteer never alone, always supported, right? So today we have trained over 260 volunteers, more than 100 clients match, and contributing almost 20,000 hours of volunteering. And we take our volunteers through a very structured training program, right? We equip them, we match them, usually 2 clients, 2 volunteers to 1 client, right? So that there's a support. We meet up with them regularly, and there's always ongoing support, right? We touch base with them, and anything, right? If there are any issues at all, not sure, call us. We are always there to support them. So these are some of the trainings that we do. And training, a lot about training, volunteer training, not about knowledge, right? Diabetes, okay, exercise more, take your medication. But how do you tell that, to elderly resident, right? So we do that through a lot of role play, right? We provide them with tools such as genograms, eco mapping, and so on. And we provide them with simple checklists like this, right? When you go to a home, how is the person feeling? Happy? Sad? How is the home? Messy, unkempt, or neat? Right? So simple checklists like this. And we work very closely with the community. This is Combined Chai Chi, where we hold the training sessions. Right? And once a year, we hold an appreciation. And this year, 2016, was very special because this is where NHG, Tan Tock Seng, National Healthcare Group, came on board and joined us for the program. So today, the Neighbours program is not only in the east, it's also in the central region. Right? So what we do is we form very close partnerships with the community. We support the client holistically, right? And we take a population-based lifelong approach. We are there for as long as the patient requires it. Okay, now I'm going to hand over to Zahara, and who will, together with Dagmar and Bessie, share about their experience.
Thank you, Dr. Shum. My name is Zahara. My volunteers, they will usually call me Zah. And today I'm going to facilitate the session. And I like being facilitator because as a facilitator, I get to Tai Chi question. I don't have to answer. Yeah, whatever questions you have, I get to Tai Chi to my boss, Dr. Shum, or to the 2 volunteers here. So Neema, are you comfortable? Are you nervous? Are you nervous?
Of course.
How about you, Bessie? Nervous a bit, huh? Okay, don't worry. We are among friends, and those are all our neighbours. Can you spot any of your neighbours here?
I don't know.
Oh, okay. So just relax, yeah? Okay. Maybe a simple introduction, Neema. We start with you. Your age, your background, yeah? And why in the first place you sign up to become neighbours? And this program, you know, is about neighbours helping neighbours, right? So a little bit about your background.
Okay, hello everybody. I'm Neema. I'm 40 plus. I'm a grandmother of 6 grandchildren. Oh, 7. Yeah.
You started volunteering?
I started volunteering 2 years plus. So I go for training with them. So from them I start to.
After training, then you are matched.
Yeah, I was matched to the client. So now,
And one thing good about the program is that what she mentioned about was that she has a few seniors, elderly staying in her block 38 Bedok South. Okay, so we have about at least 5 of our patients staying in that block. So what we do is Neema, together with some other volunteers, help us to supervise or monitor the seniors in that block itself, right? So how often do you visit them, Neema?
almost every day I visit the whole block.
Okay. And you are a stall owner, right? Very
Yeah,
busy. Yeah.
I'm a school canteen vendor. So after work, I will go visit everybody there. So because I want to bring up this kampung spirit for my block.
Yeah. So it's helping one another togetherness, right?
Sometimes we go, we eat together. Sometimes we go down to the void deck, chit chat.
And during her free time, she will accompany them for appointment, either to Bedok Poly for appointment or maybe to Changi Hospital.
Yeah.
And when then some of the seniors when they get sick and all that, what do? Do you visit them in the hospital?
Yes, I visit them, and mostly all the elderly at my block, they have my phone number, so they will call me anytime they need me.
So it's really like you, they accept you as a family member,
Yeah.
like little adik or kakak or makcik, right? So let's turn our attention to Bessie now. Bessie, a little bit about your background. How young are you, Bessie?
I'm 80 years old.
You're supposed to ask them to guess. Okay.
I'm a widow. I have 3 grandsons, and I still looking after my grandchildren, cook for them, take care of the house, and I do this volunteer work during my free time.
Okay, how did I get to know Bessie? Her late husband happened to be our patient. So we visited him, and then when he passed on, we found out that she's a great caregiver. You also look after
I look after my parents-in-law, my mother, my sister-in-law. They all have cancers. My father-in-law he's got stroke, bedridden. So I took care of him for 5 years until he passed on.
And
my mother-in-law has got stoma. I have to take care of her because of the back. I have to clean the back and all that every day. 3 times a day I do the cleaning, take care of her, bathe her, feed her and all that.
And your late husband?
My late husband has got lymphoma cancer. I took care of him also. I don't have a helper. I took care of him personally and until he passed on.
Yeah. So it's really admirable, right? I call her the superwoman now. Okay, only that she cannot fly. Yeah? So after he passed on, what I did was encourage her to come to participate in our program. But at the same time, I told her, Bessie, you need a break. Enjoy at least a few months or what. Then you come and join us because you have a lot to give. Lots of your wealth of experience to share. Yeah? Okay. So who are you taking care currently?
I'm taking care of a lady, a middle-aged lady. She has got this chronic schizophrenia or something like that. And my partner, Eugene, and me, we work together. We visit her weekly. We spend 2 hours with her every week. Take care of her, talk to her, have lunch with her. Otherwise, she will not eat. So we encourage her to eat by eating with her together. And we talk, we sing. She plays very good piano. And we ask her to play the piano, and we sing with her together. And when she was admitted to hospital, we'll visit her 5 days a week. Every day we spend 2 hours with her.
Yeah, they take turn to go
We
and
take
visit.
turns.
Yeah.
If my partner is working, she will visit in the evening and I will visit in the afternoon.
Right? So before that, when her befriendee gets admitted, she will stay for at least 20 days or 30 days. But now she always look forward to go home, right? Because she
Yes.
can spend time with our volunteers at home. Yeah. Okay. So maybe now, Neema, it's your turn. I need to turn to you for some of the key points that you want to share with the audience today. Just 3, okay? I actually is already there.
Yeah. For me, after I joined volunteering, so because I learn a lot. Before I'm hot-tempered, now I learn how to be calm. Then I also do this because I want to motivate my grandchildren and my children to be kind to the elderly and accept them as our family members.
So whenever you go for volunteering, you bring your boys along, right?
I will bring my son. Sometimes if my grandchildren come to my house, I will bring them also. Let them see how I look after, take care the elderly or this. Yeah.
But they say kampung spirit die long time already, ma. When they get rid of all the kampung, the huts, there's no more kampung spirit. Do you agree?
No. If you want to experience the kampung spirit, come to my block. Really, we did that. Every day we sit about that, chit-chat. We know each other. Then I tell you, the whole block, we know each other. Yeah. We know which unit you stay, and they know which unit I stay.
And tomorrow is Deepavali, you're busy cooking, right?
Yeah, I will cook for my resident all. Then we will enjoy down under my void deck. Yeah.
So kampung spirit is still alive, huh? Yeah, go to Royal. All right. How about you, Bessie? Any things? There's 3 points that you would like to share.
I also volunteer at the senior citizen Siglap Senior Citizen Committee, bringing the senior residents outing. We also visit them at home. We encourage them to join us.
Wonderful, she's like 40 years old.
Register them for health talk and health exercise, which is conducted by HPB weekly, 2 times a week, every week until we started beginning of this year until next year.
So it's very fulfilling, rewarding
every
also.
Thursday and Wednesday, Thursday and Friday, they will come to the CC for exercise. They have a talk first, then they have the exercise after that.
So what do you think about senior volunteerism? Should senior just stay at home and relax and look after their grandchildren?
I think senior citizens will play a big role in volunteerism. I also like to encourage those who are healthy and fit to come forward and volunteer your service to help those who are in need.
What do you think, Neema? How about you? Last call for people to come forward and volunteer.
Yeah, for me, if you got free times, just come down. You will feel happy when you see others happy. Yeah.
When other people smiling.
Yeah.
So that's it, guys. That's the end of our session. Now we open to question and answer session.
All right, we do have 2 questions from the conference room that I received.
Yes.
First question is, what is the criteria for recruitment of neighbours? I mean, is there an education criteria, someone asked? Is there experience criteria? And how are patients being matched to the neighbour volunteers? Is it only by location?
Criteria, you can As a facilitator, I get to Tai Chi my boss.
So the question, criteria for recruitment of neighbours. How do you recruit them? Is there like experience criteria that someone is asking?
Okay, there are 2 parts to it. One is the clients, who are the patients, the beneficiaries, right? So, For that, this is a national program. So like what Dr. Wong shared earlier, these are frequent admitters, right? In and out of hospital many times. But we know that patients who are not yet frequent admitters are also, at risk and would benefit from program. So about 1/4 of our patients are not frequent admitters. These could be referred from hospitals. It could be from the neighbours. A lot of times we go in, we see a client. A husband might be not well. The wife is also needs the support. So sometimes, we see one, we get one free.
Yeah.
Right.
Sometimes too.
Yeah. So that's one part. The second part is of the question is who can be a neighbours volunteer?
So for neighbours volunteers, we purposely choose people who are in the neighbourhood. So you are taking care of your own neighbours, people in your own backyard. It just so happened, block 38 Neymar, where you stay, we have 5. But we ended up giving you 10, right? You and your team taking care of them. So she go beyond the call of duty, not just to take care of the frequent admitters, but some of the vulnerable elderly staying in the block. Yeah? And she will refer those elderly to us for assistance, maybe for appointment and stuff like that. How do we match them? By language. Because Bessie doesn't speak Mandarin. Bessie, you speak Malay, right? Okay. So by language,
Okay.
gender, right? And also, it also has a lot to do with the X factor, the chemistry. So the first session is like we bring the volunteers down and meet the senior. If they are not talking to one another, the vibes are not so good, the matching is not successful.
Okay. Like dating game like that. It's like a dating game, isn't it?
I'm the matchmaker.
Yes, you are.
Yeah, then what I'll do is I'll match her to another senior.
Right.
Yeah. So it's based on a lot of factors.
There was one question as well from the conference room that asks, he or she seems to be hearing that social help is available in the northeast and central area, but not sure about the west area. But your program runs throughout Singapore, right?
No, we the eastern.
Oh, only the eastern. So they're wondering, are there any program for the west side? Coming up soon. Okay, very good. I like that. So audience members just sharing with us, coming up soon on the west as well. Great to hear that. Next question. The gentleman behind. Over there? All the way up there? We need to pass him a mic.
Hi, I'm Rafi again from Singapore General Hospital.
Yes.
Anyway, Dr. Shan, I'm one of the patient navigators in SGH lah. So, in SGH we have patients from the east, from the west, and from north and so forth around in Singapore. So, if let's say, for example, I have this patient whom patient needs a befriender service, and my patient is currently in SGH and currently staying in Bedok Block 38 in at the Neighbours house. How do I do a referral base, and will she also accompany patient for appointment in SGH?
Okay, for SGH, we're working very closely with patient navigator. Rachel, ma'am, are you okay? Okay, so what she does is, we are just a phone call away. Yeah, she has our number, she can call us directly. And this program doesn't matter whether you go to Tan Tock Seng or NUH or even to Puteh Puat, as long as you stay in our boundary, Eastern Health Alliance boundary, we will take care of you, right? In terms of your appointment, your medication and stuff like that.
That should answer your question.
And she said, my block.
If the patient is at my block, don't worry, don't need to worry.
You got the person covered, right?
No need. She will close the stall and send her for appointment, right?
If there are no other questions from the floor, there's one more from the lady over there. And that will be our last question.
Will there be a possibility of duplication of services with the Home Nursing Foundation?
Oh, that's a very good question. We work very closely with all our partners, not just Home Nursing Foundation, but St. Andrew's Community Hospital Home Care. Because we are in the community, we walk, we see who are our partners. In fact, some of them are not even known to Home Nursing Foundation, but we know they can benefit from HNF nurse coming in for some kind of wound dressing and stuff like that. We will do the referral. right? So duplication, so far there's not been duplication, but we work very closely. We collaborate with one another. Yeah. So they know that if this patient is seeing, we know if this patient is seeing HNF nurse, and then whether the HNF nurse is going on maternity, who's taking over, who's changing shift and stuff like that, we know the details at our fingertips. Yeah.
Wow, you guys really know all the stuff. Amazing what you do.
So for HNF nurse in Bedok, she is on maternity leave, so her new staff is coming in to replace her. So we know she is taking over the area in Bedok. Right, Ma?
Wonderful. That's why they say kampung spirit. Everybody knows everybody, right?
Yes.
All the things that's going on.
That's why they say we are the kipos. But not Bessie.
All right, thank you very much. Please help me give a big round of applause to Dr. Eugene Shum, Ms. Zahara Mahmood, Ms. Bessie Yap, and Ms. Nikman binti Madi. Thank you very much for sharing with us our Neighbours for Active Living program. Thank you.